Nos encontramos en el Laboratorio Dompé, en L Aquila, en Italia, con el profesor John Dart. En un principio vamos a hablar de qué es la queratitis neurotrófica.
What is queratitis neurotrófica?
It's the development of an unstable corneal epithelium, which is the skin on the front of the cornea, which is critical for vision because the light hits the front of the cornea and is focused by the cornea through the lens onto the retina. If there's any disturbance of the smooth surface of the cornea, then the patient can't see. And when the nerves are badly damaged, the corneal skin becomes broken and irregular. It can then break down completely into an ulcer, and in the worst cases, the cornea thins and you may get a corneal perforation. All of that affects vision very badly and is difficult to treat with current treatments. Don't deal with the underlying problems. They just try and we use lubricants, contact lenses to try and stabilize the epithelium, but it doesn't deal with the underlying biology of the problem, which is lack of nerves and the effect of that.
¿Esta enfermedad tiene solución a un largo o corto plazo?
This disease it have a long or short term problem.
It depends on the cause, and there are actually many causes of the disease. So patients who've had neurosurgery, where the fifth nerve is damaged, sometimes intentionally, sometimes as a complication of removing a tumor, will have lifelong problems because the nerve will not regenerate. Patients who have temporary damage due to surgery will recover sensation after 1.5 years. They will get some of the sensation back and the condition can improve. So there is a range of prognoses or outlooks depending on the underlying cause. Some patients will have lifelong problems, some will have problems for 1 or 2 years after the nerves have been damaged.
¿Cómo definiríamos el descubrimiento que ha realizado Dompé?
How you would define the discovery of Dompé?
Well, what Dompé have done is to take nerve growth factor, which was discovered by Professor Montalcini in Italy in the 50s, and they've managed to produce, with their German partners, we don't know what the cost is going to be, but it's going to be, I think, relatively inexpensive to have a completely new drug. It's a new approach to dealing with the problem, and the effects of the drug have been, we don't understand the biology of, we by no means completely understand the biology of the problem that results when you cut the nerve, because the corneal epithelium will become unstable 1 or 2 days after cutting the optic nerve with neurosurgery. And the nerve growth factor is not manufactured by the nerve, it's manufactured by cells on the surface of the eye, but the nerves in some way must be interacting with those cells to promote healing, because when you put the nerve growth factor in, we know from the previous mouse studies, and we're getting an indication from the studies with the new recombinant biologically engineered NGF, that the effects are very quick. It works in about a week to heal the epithelium, and then the corneal sensation in the patients who have the capacity to presumably grow more nerves, recover sensation quite quickly. One of the segments of this study is we can now image the nerves with confocal microscopy, and we'll be able to see what exactly is happening to the nerve regrowth in the cornea as a result of using the drug, and that is one of the secondary aims of the Reparo trial.
Cuando el fármaco esté en el mercado, ¿qué gran diferencia tendrá con respecto a los tratamientos convencionales?
Okay. When the drug is out, what is the treatment convenience treatment will be? Repito otra vez, por favor, la pregunta.
Cuando esté el fármaco en el mercado,
when the product will be out.
¿Qué diferencia con el conventional treatment?
Well,
¿Qué diferencia tiene con
What's
el
the difference with the conventional treatments?
Well, the conventional treatments are
With the
lubricants, contact lenses will work for some patients. If they have bad disease, we have to actually shut the eye by stitching the lid or giving an injection, temporary injection to drop the lid, to close the eye to get it to heal. And patients with bad disease, they need permanent surgical partial closure of the eye to keep a stable epithelium, not necessarily to get good vision, because the cornea remains slightly rough and irregular. So this does offer a completely different approach to treatment with much better outcomes. You've seen that some of the patients I presented, their vision has improved because the surface has become smooth again. And also, in the murine studies, we found that in a lot of the patients, they only needed one course of treatment, probably because of the effect on regenerating nerves. It seems to be quite quick. So that once they've had a course of treatment, they don't necessarily need to have repeat courses. That may be necessary for other patients. But most of these patients are taking, to maintain themselves, are taking drops every hour or two, lubricant drops. And currently we're only using 6 drops a day of this. And I think we're pretty certain they won't need, few of the patients will need this in the long term, if what we're finding already is confirmed by this much bigger study that is being done now.
Una última pregunta. ¿Las enfermedades de oftalmología han sido las que más han avanzado?
The disease of ophthalmology is one of the most advanced, being advanced
en los últimos años.
latest years. Repite, por favor.
Las enfermedades de oftalmología, la oftalmología.
The disease of ophthalmologists
ha sido las que más han avanzado en los últimos años.
It's almost being advanced in a couple of years. Is it progressing? The ophthalmology is progressing right now more than all the
Well, ophthalmology has been
studies.
progressing. Sorry, you were saying compared to other
yes, exactly. To other studies, are there being more progressive the studies of the disease of ophthalmology? You consider that?
I think if you're asking, is ophthalmology progressing fast, it is in many areas. I mean, you know, we were the first to be using lasers in large amounts, and a lot of the drug development, really, since Xalatan was introduced by Pfizer, I think I've got the company right. They made $1 billion and out of this eye drop. And because of that, a lot of money is now going into ophthalmic drug development in the last 10 years, because the big companies, this is expensive to do, and they realize there is money to be made out of developing good drugs for ophthalmology. Dompé is looking at these relatively small areas where they're called orphan diseases, which are rare diseases, which are often ignored. There is more interest now in developing drugs for these rare diseases. What is interesting about NGF is that it may have a role in much more common disease than this particular.
So we're advancing, we're getting more information.
We
focus
are.
more.
Yeah, no, it's very exciting time to be working in the field.
Right. So we're doing.
Thank you, Mr. Hart. Que sigan las investigaciones.
We keep it up, investigate.
It's a pleasure.
Okay.
Very nice to meet you.
Thank you.